is a certain method of transmission. For example, like COVID-19 or influenza A H1N1, that is swine flu, most commonly called. These are respiratory viruses. So naturally, they spread through your respiratory route. So your sneezing and coughing, all these lead to the transmission. But many times, different viruses actually transmit in a different way, like rabies. When the dog bites any person, the rabid dog, due to bite of that dog, rabies is actually caused. So rabies is also a virus. Okay. So, but the route is different. So naturally, it is not through the respiratory route. So as per the route of the transmission, you need to take the precaution. But as far as COVID-19 or swine flu is concerned, there are universal precautions, universal infection prevention precautions that we are following. You might have heard about the PPE, that is the personal protective equipment. So everybody who is working with the patient, treating the patient, or who is working in the laboratories, they are wearing PPE. The That means they are covering their entire body with the protective shield. Just like even the head garage for the head, then the goggle, then the entire gown for even the hand gloves, and even the shoe cover. So from top to bottom, the that particular person who is working with the patient or the lab sample is totally covered to prevent the transmission. So that is one way. And for other people who are not working in a infectious environment, they are only applying the mask, wearing the hand gloves and all that. Because depending upon in which conditions you are actually working, what is the probability, what is the exposure threat of the particular infectious agent, depending upon that, the protection level also either increase or decrease. Yeah.
Thank you, sir.
Sir, my
Yes.
next question to you is, certain studies have proved that pandemic takes place at every 100 years. So why is it so?
Actually, it is not like that only because unfortunately, in this 21st century, we have observed two pandemics within a decade's time. In 2009, we have observed swine flu pandemic. It was a pandemic. Though when you look at the extent of the pandemic, it was now moderate as compared to the COVID-19, but definitely it was a pandemic. So in 2009, we have observed the swine flu pandemic, and in 2021, that is almost after 12 years, we are landed into another pandemic. So it is not that every pandemic has the it is in only in a century or like that. On the contrary, you may get pandemics very frequently also. The thing is that for such things to happen, the novel the novel microbe is necessity. When pandemic spread, when that particular microbe is quite newer to the population, the entire population is virgin population. That means not having any immunity against that particular disease. Then that population gets affected very rapidly. As we know, COVID-19 was an entirely new microbe. Nobody has experienced COVID-19 previously. So the entire global population was totally unimmunized, not having any immunity. That is why with rapidity that has spread. So similar novel microbe generation is not everyday's thing. It takes some time, maybe 10 years, 20 years, 50 years, like that. But that much time is required to create different variables and the drivers to force such kind of pandemic. That is why there is some gap between two different pandemics, but it is not exactly 100 years as we always thought of.
Okay, sir.
Sir, my question to you is coronavirus existing one? How COVID-19 virus is similar or different to flu?
I got your second part of the question, but what is the first part of the question?
So, was corona An existing one?
Existing one means what exactly you want to know, Joey? What exactly you want to know in that particular question? Otherwise, I will give you the.
Sir, I
Yes, please go ahead.
सर आई मीन मतलब कोरोना पहले से था या जिंदा था या अभी अभी न्यू
Acha,
न्यू आया
acha.
है?
Okay. I got it. Okay. The only thing is that we are well aware about the corona family as such. Corona viruses are older one. So you might have heard about the SARS uh, uh, outbreak in 2003. So SARS was a coronavirus itself. Then in 2012 we have a MERS outbreak. MERS was also a coronavirus. So till date we are well aware about 6 different coronaviruses previously, but this coronavirus was a newer one. That means it is from the same family, but the new baby. We know the corona family, but this is the birth of new baby in that same family. So we are aware about the previous siblings of the corona, but this sibling was a newer one. So that was the thing. And as you have asked very rightly, what is the difference between flu virus and coronavirus? Basically, when we call flu, it is basically influenza virus. Okay. So influenza and corona both are basically viruses which enter our body through a respiratory route. So sneezing and coughing, all these actually are the leading cause of transmission, and the symptoms of both influenza or swine flu and corona are similar. Both are RNA type viruses, but definitely the virus is different. This is the coronavirus, this is the influenza virus. So in that way, virus is different, but the mode of transmission and the symptoms are quite similar of both corona and influenza.
Okay, sir. Thank you.
Yes, who is going to ask next question?
Sir, is coronavirus the most dangerous virus scientists have ever researched?
Good afternoon,
Pardon.
sir. Virus
Yeah.
has different impacts on different people. Why?
I'm sorry, I couldn't listen you properly. Please, Guru Prasad. Will you repeat your question?
Good afternoon, sir.
Good
Virus has
afternoon.
different impacts on different people. Why is it
Okay.
so?
Yeah, okay. That is good question. Basically, as we discussed, this depends upon the different variables. Like different people have different level of immunity. That means many times, as I have said, as far as corona is concerned, we are well aware about the 6 different strains of corona. Those were existent previously also. So whenever you get common cold or such symptoms, even in a pre-COVID era, uh, corona was one of the virus that can cause common cold also. So we might have the corona common cold previously prior to COVID-19 pandemic also. So those who have had such kind of corona exposure previously, they are actually having some level of immunity against that particular virus, and that immunity, which is called as cross immunity, is helping a bit while dealing with the new virus. That is one thing. Second thing is that the person immunity also depends upon different factors, your nutritional status, your overall health as such. So that also actually helps you in dealing with any new infection. So those who are malnourished, those who are having different diseases like hypertension, diabetes, kidney disease, so they are actually more vulnerable for infections because their body is debilitated due to the various conditions. So they cannot fight the new infection that effectively as a healthy person can. That is why, depending upon even the age factor is also there. Our 60 plus population, that means our grandparents, they are more vulnerable because they are age old, and so naturally their immunity is reduced. So such type of different variables do play a part while dealing with the infection. So that is why some people are more vulnerable for infection while some are not. That is why we observe that there is serious infection in some people, but while some people are actually almost asymptomatic or having only mild to moderate disease.
Wow, sir, great.
Thank you.
Sir, my next question to you is, what are the reasons behind new variant found?
Yeah, because Jia, that is quite an important question. You know, we call this particular virus as a RNA virus. So the genetic makeup of these viruses uh, is different for different virus families. One thing is that virus is rather an enigma or a difficult mathematics or a, riddle to solve for the science also. Even one should we call a virus as a living or non-living object? That is also the question in front of scientists. So because virus always requires a living cell to multiply, virus cannot multiply on its own. Virus requires a living cell of some animal or human being to multiply. So that is very part of the natural life course of the virus, that viruses do change. And why they change? Because everybody has a eager will to survive. So whenever the environment, the ecology is going against you, then viruses actually change their genetic makeup to make them compatible with the ecology or environment around them. For example, you had a vaccine. For example, you had an antiviral drug. Now virus has to deal with that antivirus drug. These people are using remdesivir for me to kill me. So I need to develop something so that I can fight remdesivir, because virus also wants to live there. So that kind of things are happening, and so virus changes its genetic makeup. When virus changes its genetic makeup, we call it as a new variant. So because what is virus? Virus is basically the bricks made up of amino acids. There are 4 amino acids, and they are actually attached to each other in a certain sequence. When that sequence get changed, the bricks get changed. The lower one bricks get to upper side, upper one comes to lower side, and the wall looks like different than the previous one. So naturally, this is the new variant. So virus keeps on changing to survive, to sustain itself in the environment, to to protect itself from the new drugs that humankind has actually invented, or to protect itself from the vaccination also. So that is the way why virus actually changes.
Thank you,
Rather,
sir.
Jia, yeah, rather, Jia, I just want to add a single line there regarding even the changes in genetic makeup. You know, we people do type something on
Yes,
the
sir,
computer.
sure.
Yeah, we do type on computer, and sometimes what happens, the same page we give to somebody else and ask him to type the same paragraph, and he actually he or she does some mistake, the spelling mistake in that. Okay, so the n number of students are typing the same paragraph, but they are making some mistakes. It is the same way when virus multiplies, then there are some mistakes, some spelling mistakes in the code, and that leads to the change in the genetic makeup. That also happens with virus. Yeah, please.
Thank you, sir.
Yes.
Sir, my question to you is, Corona vaccine took 8 to 9 months to be prepared, but HIV virus vaccine is not yet prepared. Why is
And,
it
and
so?
yeah, as you know, all actually uh, different viruses have different modes of transmission. They have different genetic makeup also. Okay, it is just like solving the different mathematical puzzles. The answer for each and every puzzle or is not similar. Some puzzles we can crack down very easily, but some we cannot, because the nature of the puzzle is different for different mathematical puzzles. So naturally, it is not easy to prepare vaccine for each and every microbe. Okay, and as such, whenever we want to prepare a vaccine, it takes at least 8 to 10 years. It is not 8 to 9 months. This time, what we have done, we have prepared it very fast, and we actually bypass some of the necessary steps for the approval. And the vaccines we are using are actually under EUA. That means emergency use authorization. That means they are being used as an emergency. Routinely, they will not have been approved in routine process, but as there was an emergency, it has been said that this is emergency, so that you can use it. You can actually bypass some of the steps of vaccine development and go ahead, because we want to save the population, we want to protect our people, and that is why under emergency we are using these vaccines.
Thank you, sir.
Yeah.
Connection it
Yes, who is going to ask the next question?
Sir, if in future any pandemic comes again, how will you speed up the procedure of making vaccines?
Yeah, Tanmay, actually, it is not only the speed up the process of making vaccine, but as a society as a whole, we need to actually gear up the entire public health system. We need to have very good hospitals. We need to have more doctors like you people, because our population is quite huge. And as compared to our population, the population of doctors and nurses and other medical staff is not up to the mark. So naturally, we require more medical personnel in the future. That is why we need to invest in public health much and more. And at the same time, as you know, now with the help of science and technology, we are quite able to actually enhance the process of vaccine making. So as you know, now we are using the mRNA platform, the recombinant technology. So different technologies are coming ahead, and we can prepare vaccine quite faster. So that is happening. But that is not only useful, because vaccines are not the panacea. That means the answer for all the diseases. This is not the panacea for each and every disease. For that, you need to make your health system more robust, more strong. You should have more hospitals. That too, they should be affordable to the all the people, because many times what happens, the rich people can go anywhere, they can spend as much money they can want, but the poor people, they are, because they are poor, they do not have money, they cannot afford to get treatment at the hospitals, and they really unable to get it. It should not happen. In spite of your financial condition, you should be able to have access to the healthcare. So that kind of healthcare we need to develop, and this is the responsibility of people like me and people like you, who are the next generation of India.
So, my question to you is how does RT-PCR work?
Yeah, because we use 2 to 3 different tests to diagnose COVID-19. So whenever there is an outbreak of any disease, our laboratories are very important. They are the backbone of our disease control mechanism. Without laboratories, you cannot do anything. So for COVID-19 diagnosis, we are using 2 to 3 different tests. One important test is RT-PCR, which is the reverse transcriptase polymerase chain reaction. It is called as. What it does, it actually takes the nasal or pharyngeal swab of the suspected case, and from that the RNA has been extracted, and then there is amplification of that RNA, and then that can be picked up by the machine, and then we say the patient is positive or not. So this is basically a nucleic acid amplification test. That the technique used by that particular test is nucleic acid amplification. Okay.
Okay,
Yeah,
sir.
please.
My next question to you is, some people have a myth that after vaccination they are safe and they stop following the precautions. So, what is your opinion?
Actually, as we all know, as I have said, vaccine is not the panacea, or vaccine is not the ultimate answer to this pandemic. Vaccine alone cannot stop this pandemic. So, along with vaccine, we need to actually develop the habit to observe very stringently COVID appropriate behavior. That means using mask, frequent cleaning or washing your hands. So whenever you are sneezing or coughing, you should observe the respiratory etiquettes. You should not actually sneeze or cough on anybody's body. So such things are quite important. So uh, observing this CAB, that is COVID appropriate behavior, is equally important as with the vaccination. Yeah.
Yes.
Yes, sir.
Sir, my next question to you is, what was the most effective factor to flatten the curve of wave 2 of COVID?
The pattern to pattern the curve of COVID, it is not uh, individual. Any individual cannot do it. As a society, as a community, we can do that to pattern the curve, because it is very tough to pattern the curve. That is why, as we know, doctors, nurses, ward boys, even our ayahs working in our medical hospitals, laboratory personnel, and in the common people, actually they are observing the COVID appropriate behavior, all come together, and that is why it was possible to flatten the curve. So it is the teamwork, as you know, in a 2020 match, like 50 in a one day match, one cannot win the match. It is everybody has to give his or her role in that winning, and then you can win. So the alone Virat Kohli or Rohit Sharma cannot win the match. So naturally, in flattening the curve of COVID also, not only doctors but the common people, they are also played their role. They actually behaved bravely, and they followed all the precautions. That is why we are able to flat the curve.
Thank you, sir.
Yeah, welcome. Any other question you want to ask?
Yes, sir.
Yeah, please.
So, my next question to you is, are we expecting more variants or is it the ending of Corona?
Actually, Ananya, at present, it appears that we are almost, the third wave is totally vanished now. But as you know, viruses are very notorious, and they do change frequently. So new variants will be the rule of the day. New variants will definitely come. But as you know, now we have observed three waves, and we have actually exposed to the different variants like alpha, delta, omicron. So now the population has some immunity against the virus. So even though the new variant will come, actually the population is not now that non-immune. We have the herd immunity. That means the immunity of the society, the community immunity. So it is there. So henceforth, it appears that COVID will not go totally. It will not like that. There are zero cases of COVID. You will report as we are reporting today, 100 cases of COVID, 50 cases of COVID. So some scattered cases of COVID will be there, but it will not be in that large extent that we observed during first, second, or third wave. So COVID will be with us, but just in a scattered manner. We will meet somewhere in some months in some area, not that frequent meeting. So that is the actually prediction for COVID-19. Let us see what happens.
Yes, sir. Okay.
Sir, what advice would you like to give to the people about pandemics?
I actually, Tanmay, not only about pandemic, but overall for the communicable diseases, we should be very cautious. We should pay our attention towards our public health system. We should actually design and ask our planners to develop our public health system in such a way that it can handle any pandemic or any eventuality, any health related crisis in a better manner. That is one thing. At the same time, we should, as a person, as a community, should observe the healthy habits like exercise, avoiding junk foods, avoiding soft drinks. So that is necessary. So that is need of the hour, because nowadays even the students like you, our screen presence is increasing day by day. We are not playing on the playgrounds. We are just sitting, holding our mobiles and all those things. So this is basically not the healthy habits. So in the long run, if you want to build your healthy body, you need to inculcate the healthy habits too. It is not only vaccination, but your healthy habits will help you in the long run to deal with not only COVID, but any future pandemic or any future disease that is coming in our way. So that is why it is needed that as a community and as an individual, we should actually follow the healthy habits and build our public health system in a very robust way.
Thank you, sir.
Yes. Any question?
Excuse me, sir. The
Yeah.
XE variant of COVID 19 is detected in India. What are the symptoms of the new variant?
Actually, Guru Prasad,
Yes,
XE
sir.
is not as such the newer variant. It is only the combination of two sublineages of Omicron variant, and we have already come across the Omicron. So there are BA.1 and BA.2. So these two variants get combined, and XE variant has been developed. So there are no new symptoms of XE variant. It is in a similar way of Omicron or any COVID-19. The symptoms are similar. It is not deadly virus or as such. So there is no need to panic. Okay, it is, as I said, basically changing the genetic makeup is actually the habit of the virus, and many times these changes are not that relevant. So as of today, XC is nothing to worry about.
Thank
Very
you, sir. This
informative,
was very
sir.
Yes, sir.
important
Very
for us.
important.
Thank you, thank you.
Sir, would you like to guide more us on our project?
Yeah, basically, nowadays there is a concept of one health jia. One health means actually the health of human beings, health of animal, and health of environment. They are not separate, but they are interdependent. So when your environmental health, your environment is not healthy, then human health is also disturbed. When your animal friends are not healthy, then also human health is actually disturbed. Now there is a climate change, there is a global warming. So all this is leading to the uh, uh, many emerging and re-emerging diseases. So we should also focus on the environmental health issues also. We need to work for actually avoiding global warming. We should try at our level also to actually cut short the hastening process of climate change. So we should actually uh, walk to our schools, walk to our market. We should use bicycles instead of bike and cars. So all these things are important. So we should actually incorporate the environmental friendly habits in our daily routine. So I think you should actually use it yourself, and at the same time you should make awareness among your community, among your families regarding that the environmental health is important if you want to avoid in future such kind of pandemics.
Very truly said, sir. Thank you.
Yeah.
Thank you, sir. We are very grateful for interviewing you today. You have given us your valuable time and a clear picture about COVID 19. Once again, thank you, sir.
Yes.
Yeah. While speaking with you, I also thought that I am sitting with you in a standard class. So I lost some of my years and just become like you. So be curious, be great, and be studious, and actually use your knowledge for your family, for your society, and for our country. Thank you.
Sure, sir.
Yes, sir. Thank you.
Thank you, sir.
Thank you, sir.
Bye.
Thank you, sir.
Bye.
Yeah, you're welcome.
Yes, sir.
So I will leaving the studio.
Yes,